Good morning, everybody. My name is Brandy Cool with the Pennsylvania Head Start Association. I'm very thankful that you are all here today. We are partnering with the University of Pittsburgh School of Education, and they are highlighting their infant mental health certification today. It is an honor to work with them. The association really values infant mental health, so we are privileged to be able to welcome Dr. Robert Gallen today to speak to us about that certification program.
Awesome. Timmy?
To you.
Timmy, thank you, Brandy. Thank you so much, everyone, for being here. I'm honored to be here and be talking to you guys about what we're doing at University of Pittsburgh. I'm going to go ahead and share my screen here and just give me a moment to get that up there. Oh, all these things are blocking my tabs. So there we go. All right. Can you see my slide there? All right. Okay, so in case you don't know me or didn't see the last time I presented briefly, I think I did 9 minutes or 7 minutes or something. Um, I'm Robert Gallen. I'm a clinical psychologist at the University of Pittsburgh, where I'm a professor of health and human development in the applied developmental psychology program, where we are building content in infant and early childhood mental health. I've worked over 20 years in their Part C early intervention system, but I've also collaborated and done lots of work with oops, that's popping up with um, Head Start or early Head Start, early education, mental health. Also a lot with Pennsylvania Association with Infant Mental Health. So I've been involved in a lot of systems, and in particular building content in infant and early childhood mental health. Um, as some of you may or may not be familiar, when I was at Chatham University, I left there about 11 years ago. We built in collaboration really with the state. We had built a certificate in infant mental health. It was the first one in Pennsylvania at Chatham University. Um, and that was really successful. And left Pitt or left for Pitt because I was like a one-man show there, to get some support and to build bigger and better and to do more. And this is that. I'm very excited that Pitt's giving me support and the opportunity to build this. What we are doing here is this is the first step in sort of three things we're going to be offering. And I can't, until those other things are approved, I can't tell you what that is, I don't think. But this is going to be our certificate in infant mental health that we're taking completely online. We've had a certificate for the last 4 or 5 years, but you had to be at Pitt to take it. And really didn't give people access, right, who are outside of weren't nearby and couldn't get to campus and do all the work. So we've taken this completely online to allow for a broader exposure and access to infant and early childhood mental health content and training. The other part to this, though, was there's meeting with folks across the state and at different events. There was a real interest not just in training in infant mental health, but articulating training, continuing education, and all that into credits, into graduate credits. So this program does some of that. So I'm going to talk about our certificate in infant mental health. You can see the header, your expertise deserves a graduate credential, and that's what we're really trying to do. And if you're not familiar, that's what's going on across the country, right? There's infant mental health endorsement, not just the country, actually the world. Um, Infant mental health endorsement is in 36 states now, including Pennsylvania. We are an endorsement state. Ireland, Japan, Australia are countries, and when you're endorsed in one place, you're endorsed in them all. Is reciprocity. The idea is to really acknowledge that the work we do with infants and young children is specialized work. It is not a step down from doing child or adult work, but it's actually quite specialized, quite and incredibly important because we change developmental trajectories of infants and young children at the very time that we have optimal impact when the brain is going through an extreme neuroplasticity and development and responsivity to the environmental influences. We are there to enhance environments and optimize development, um, reduce risk to development, right? And we do a great job at it. And so the idea here is to enhance that work, and also validate it, right? Recognize that what we do is really specialized. So let's see if this thing will let me advance. So, um, Pitt, we've been around, we've been in the game for quite a time, well before I came to Pitt. We have our Office of Child Development at the University of Pittsburgh, which has a long-standing early Head Start home visiting program that was heavily embedded in infant mental health from the get-go. They're of amazing folks, and a lineage of Emmy Titnich and Viv Herman and Chris Dunkerley and others who brought in experts in the field to on a regular basis to train staff to think from an infant mental health perspective. Back when I built the program at Chatham, they came to me and said, "We want to be a part of this," and they made that Chatham program successful. And they're here now too, right, supporting us and being a part of this work that we're moving forward. So, University of Pittsburgh's had a long history of working in the space, working with children in orphanages across the world through Office of Child Development. And currently, they're housing one of the home visiting programs, right? One of the we have 8 in Pennsylvania, I believe, right? Um, um, we also have been doing infant mental health work since well, I mean, I'm sure other people have done similar work, but when I came to Pitt, I built a certificate, but I also built a continuing education online course. That was my pandemic project, I would guess you'd say. It took 18 months to build a single online continuing education class. And we've been fortunate that early intervention technical assistance has been sending us or supporting scholarships for students to take that course. Um, I think we're going to be over 1,100 folks across Pennsylvania will have taken the course by the end of this year. Um, it is a Foundations of Infant Mental Health class that's continuing education. It's low cost and competitive, completely asynchronous on online, and that so we've been doing that, and the feedback we get is phenomenal. People really find it impactful on their work, which is just thrilling. I have to move our little things here. Um, and of course, we have this connection with the Pennsylvania Association of Infant Mental Health, PAAIM, in that, anytime we can partner with them and work with them, a lot of their leadership have connections to the stuff we've done at the University of Pittsburgh. I personally was one of the founding folks of PAAIM, so I'm very proud of their work that they've done moving forward. So we'll continue that as well as our alignment. We're missing an H in there, but we'll not worry about that. All right. So let's get to the certificate. What we're building here is a graduate credential, right? So this is master's level. You do need a bachelor's degree. Um, but I am thrilled what Pitt has done here. They have allowed for one of the barriers to doing graduate training and all that is just the cost. And we're in early childhood, and if you're working and having the resources to move on to the masters, right? That can be a challenge. And Pitt has decided to support this as a mission-focused program with a reduced, so mission-driven cost. I'm jumping ahead, 29% below the standard graduate credits. They looked at what's going on around the country and decided to be competitive in the market, but also to acknowledge that this is a critical and important workforce doing critical important work, and we need to give access to people to the training, to the certificate, and all that. The format of this is fully online. It is a unique format. Rather than, typical semesters, 15 weeks, we're doing 7-week courses. And instead of taking 2 courses over a semester at the same time concurrently, you're going to take 1 class at a time in the certificate. So 1 class, 7 weeks. There's no set class time. There's, there'll be, but there could be some optional meetings and times to touch base and things like that. But for the most part, doing the work on your own. We're in the process, we're recording lectures, we're finding, inserting resources, we're bringing in experts to create content. Um, so there's no commuting, there's nothing like that, but rather when have time each week, you can go into the class, do the work, listen to a lecture, read a resource, watch a video, do an activity, et cetera, et cetera. That does make it a bit, you're going to be working every single week for seven weeks. Then there'll be a little break, and then we start the next class, right? So we really focus in on a singular topic rather than spreading out your thinking across two classes. It keeps it more organized, and it's the students tend to report preferring this model. The overall program is it's 12 credits, so it's a class that starts in August, then the second one in October, the next one in January, and then the fall, I believe the next one's about in March. So 7 week intervals, and that's the full certificate, 2 semesters, 2 terms. You can see the cost per credit, 750, which is a nice reduction. I'm really thrilled about that. I've never seen that before, and I tried to do that. And here's Pitt's now, like really wanting to do that. Who this will be taught by me by if you're familiar with Gil Foley, who is from Reading, Pennsylvania, but also a national expert in infant and early childhood mental health. He's involved. We have local and regional, clinicians. Met with a trauma therapist yesterday who's creating content for the class. So bringing in folks from UPMC, Western Psych, occupational therapists, physical therapists, LPCs, psychologists. We're really going to have a diverse set of voices in the courses. Again, there's 4 courses. We're really focusing on evidence-based practices, but also infant mental health theory and practice, and sort of integrating that, right? And of course, the courses do align with the PAAIM endorsement and those pathways. So, we're at the end of the, you're able to go ahead and apply for endorsement. Of course, you have to meet other requirements for endorsement. Um, Not because, work experience and reflective supervision are not built into this particular course. Um, what happens? Why do this? So the idea here is, and this is partly based, I partly built this on, so I told you, I'm currently about 1,100 people have taken this online course, and I get these emails. Well, what's next? What now? I want more of this. I want to dive deeper. Um, for those of us that are doing this work, a lot of us, once we get a taste of infant mental health, we want more. I'm one of those people. I'm meeting a lot of those people. So this is that next, right? But we're also looking to, advance people's role, right? So there might be folks who, you know, really want to dig in deeper, get this certificate in infant mental health to expand their, sort of acknowledgement of their a graduate level credential, essentially to signal their expertise to supervisors, to employers, to those they work with. All right. I don't know if my name was up there, but when you do this kind of coursework and get endorsed, you get to put the IMHE endorsement after your name to recognize your work in the field. So whether this means a promotion, a new role, or simply being recognized as the specialist you are, that's important, right? That you've trained in infant mental health. Perhaps you want to move into leadership, supervisory, coaching, program coordination roles in early intervention or home visiting, right? More and more the credentials and demonstration of expertise and training is critical. We're trying to provide an opportunity regionally to do that. Of course, building expertise in this growing field, Pitt did smartly did market analysis and looked at, what's the state of the field, and it turns out that infant and early childhood mental health is a growing field, and there's a knowledge known need for more people doing the work across the country. We're not meeting and supporting all the kids that need our help. In part, that's because, there's a lot of reasons for that, but part of it is that we need more of us. And of course, standing out to employers and funders, credentialed infant mental health professionals are increasingly sought out. This is increasingly recognized. One of the things I'm proudest about with the development of PAAIM and this work in infant mental health, we've been doing this since started 2004 in Pennsylvania, is that a lot of people know what infant mental health is now. A lot of people recognize it. More and more, the language we use, the ideas we have are universal, and that's, I think, messaging that we've been doing for the last almost 20 years. What do you learn in the program? Well, we're going to really focus on applied skills, right? There are programs that are not just, knowledge based, but there's also programs that are skill development based, and we're going to do knowledge and skill development. We're being very intentional on making sure that people who take these courses and to complete the certificate walk away with new skill sets, new abilities and capacities for observation, assessment, for intervention, to really, skills that they can apply day in and day out in their work. So we're going to focus on the when you look at the courses, let's start with the foundations of infant mental health. If you took that online Foundations of Infant Mental Health course with me already, one of the unique things that Pitt also did here was they are actually going to count that course toward this foundations course, right? So you already took it. When you come into the certificate, you will, as long as you got a B in the class, essentially 80% on quizzes and the continuing education exam, you get credit for that course. Then you move on, right, to taking courses in developmental context of risk and resilience, really looking at how do we use attachment theory to identify risk and resilience? How do we support caregivers in supporting their children through secure attachment behaviors? How do we observe that, assess that? How do we account for risk and promote resilience? We'll have a whole course on typical and atypical pathways, really looking at problems in mental health identification. And this is classes both sort of knowing about, different disorders that occur in early childhood. We're going to be doing DC 0 to 5 training. Gil Foley and myself are both going to be trainers in that. But also, being able to recognize and assess, atypical from typical development is critical. And then, of course, that really focuses on diversity, equity, and reflective practice. So really getting into the work itself and being reflective practitioners, culturally humble, and working from that perspective in implementing the big, infant early childhood mental health, the reflective capacity of ourselves, and promoting that in the caregivers that we're working with, because we know that reflective function predicts secure attachment. Though we're going to really focus in on that, and within that, of course, how does culture and those factors, kind of play into both our own and the families that we're working with, play into the work itself. What you'll bring back to the families you serve, the idea here is to enhance practice, right? We want to make this really, we were just talking about this. We had a meeting earlier this week where we're hoping to change lenses, the way we, and not, change lenses is in the way that we can go and meet a family, look at an interaction, and see things, right, with some clarity in terms of what's going well here, what do we need to enhance and support, how do we move the interactions for this child and for this caregiver towards, more positive, supportive, developmentally promoting ways, right? What do we do to do that? But we need to see it first before we can change it. And so we want to enhance practice. We want to improve family engagement through reflective practice, through cultural humility, through knowing oneself, right? And diversity informed tenets and all that. So really building tools for engagement and understanding, for listening, observing, understanding and reflecting. Of course, being trauma informed in this work and very equity center practice, recognizing factors and variables that are stressful, that are traumatic, that produce fear, and how do we work and support that, and and reduce that for children and families, and also attending to equity within that. And ultimately, all of this is about, right? This has been, I think, many of our missions throughout our careers, better outcomes for infants and toddlers. That's what it's really all about. Um, as an educator, I'm an early intervention practitioner for 20 years, but I also happen to be a professor in my day job, I guess, or my other job. And bringing that practice, right, to students and to people who are doing the work, and sort of sharing that and learning together and promoting high quality practices across the field is just the mission, right? And that's all about the infants and the toddlers, right? That's just part of what we need there. I impart, to be honest, when first built infant mental health stuff, it was partly because I wanted it, right? I wanted to learn, and it's like, well, if I'm learning, let's. Does anybody else want to learn? Let's do this together. Um, Okay, so your program week by week, you take one course at a time. It is intense. I mean, it's a lot of hours. But you're taking one class and you're working somewhere between 15 to 19 hours. Now, what does that mean? Well, some of it's going to be lectures, right? And we're not doing like hour and a half lectures. We're doing, 20-minute, 15-minute segments, and then you might have a discussion board, or you're going to have some readings each week. And we're really paying attention not to make it overwhelming and impossible to do, but we want you guys to be able to succeed, and also learn a lot. So about 15 hours, and that again, it's discussion boards, it's videos, it's readings, etc. All is accounted in that 15 to 19 hours. Fully asynchronous. You work at your schedule, your pace. We will actually have a suggested little, I love this. I work with course designers and they're awesome. We will have sort of a day-to-day, here's what you should do, here's a good plan. You don't have to follow that. You have complete autonomy to do it as you want. But right, here's a suggestion if you want to keep up and you're doing a little bit each day, whether it's a reading, watching some video, lectured videos, an activity, a discussion, and so forth. Next up's how to apply. It's straightforward. We would, hope people would apply by August 1st for a fall start because it starts a couple weeks later. Um, but to do this, you want to create your GradCast application. You apply again by whatever. There's a fee, but fee waivers are available for eligible applicants. I know that's great. I didn't know that was possible, so that's cool. So I'd check into that. So submit your required materials: a goal statement, resume or CV, recommendation letters, and we've asked for there to be and I think this is go through. That there not be as many letters of recommendation required. So I'm not sure where that's at, but we're trying to make it's a certificate. You don't need to, we'll see where that's at. And official transcripts, right? Because it is a graduate credits. And then, of course, we're here to help you. Questions about any of this, email online at pitt.edu, or me, robert.gallen at pitt.edu. If it's admission stuff and transcripts, I would go to that online at pitt.edu. But anything about the program, the content, all of that, feel free to reach out to me. Um, Also, just so you know, we do have this non-credit bearing course, the Foundations of Infant Mental Health. It's low cost. I believe it's $399. You do get continuing education credits. We have Act 48, we have PQAS, and we have a general just certificate, right? That could be applied for infant mental health hours and early intervention, things like that. And nursing, which I was able to get this last year for Nurse Family Partnership. And we've had several nurses complete the course. So it's 45 hours of continuing education, which is pretty great. Again, this course, if you took it already, or you want to take it, you just need to you need to pass the assessments at 80%, and it shows you here to go to Pitt Professional to look up infant mental health to do that. Okay. All right. Anything else here? Next steps. try it out. You can try the CE course. You can talk with us, right? You can start your application. You can reach out to me. There's my email. I'm happy to talk to anyone. This is really, I'm someone who worked in the field for 20 years. So this is and the folks I'm bringing in to teach are often people that I worked with in the field doing this work. And that's incredibly fun. They're professors. They're working at clinics and doing great work. So this is that it's just a passion project, and I'm really really excited to share this with others. I lost my mouse, so I can't seem to do anything. Okay. Oh, here we go. And there's my mouse. Anything else here? Well, I'm not sure what the three quick questions thing was. What was that about? I'm not even sure. Let me get over here real quick here. I think next thing is to scan the QR code.
All right, scan the QR code. Sounds like there's going to be three quick questions. If there's any, sorry, Robert, you had frozen.
Oh,
Greg
okay.
is showing the links in the chat. It is 9:29. I just wanted to take a quick pause. I know we were asking questions in the chat. Greg was able to get to most of those. Were there any other last minute questions while we had Dr. Robert Gallen with us? Okay. Thank you so much for your time. I appreciate you being here. I will send out this recording yet today. So if there's others that you wanted to share it with or take it back to your leadership team to see if this would be a possibility for you, I'm happy for you to utilize it however you'd like. I will also be sending out any contact information and all of those different types of things that you might need in the email as well. So thank you everybody for being here. We appreciate it.
Thanks, everyone. I appreciate
Thank
it.
you.
Thanks, Brandy.